Thank you, everyone, for joining us for today's webinar, 40 Years of HIV Criminalization and a Path to Reform. We now turn to our moderator for today's discussion, Nathan Cisneros, who is the HIV Criminalization Project Director here at the Williams Institute. Nathan?
Thank you, and thank you all for joining us here today at the Williams Institute here on World AIDS Day to talk about 40 years of HIV criminalization. We have a fantastic panel of participants here today. If you have any questions during our presentations and remarks, please use the Q&A function. Feel free to raise your hand as well or drop questions into the chat. Why don't I begin with an introduction for myself, and then I'll hand it over to my colleague Jada for her introduction, and then why don't we get directly into presentation for today. So my name is Nathan Cisneros. I'm the HIV Criminalization Project Director here at the Williams Institute. We're a research center at UCLA's law school. Why don't I hand it over now to my colleague Jada?
Hi, everyone. Thank you for being here. My name is Jada Hicks, and I use she, her pronouns. I am the Senior Positive Justice Project, or PJP attorney for the Center for HIV Law and Policy. CHLP is a multiracial organization that uses a Black feminist queer lens to analyze the issue of discrimination, criminalization, and oppression of people affected by HIV and other stigmatized conditions. And we work and envision a world where people are not dehumanized and punished for their real or perceived health status and our identities, and where health conditions are not met with criminalization, surveillance, and other punitive responses. Would you like me to go ahead and just jump into my slides, Nathan? If so, you can progress by to there we go. Next slide, please. So if you are interested in learning more about PJP, or Positive Justice Project, was a central component of CHLP's work. It's our national campaign to end the decriminalization of HIV and other stigmatized health conditions. Please scan this QR code to get involved in the work. And we work with state and local coalitions of people living with HIV, advocates, researchers, nonprofit leaders, government officials, and other stakeholders. And you can always reach out by email too if you have any sort of questions either about PJP, CHLP, or getting involved in HIV anti-criminalization work. Next slide, please. I always like to level set with some definitions going into this conversation, so I really want to start with some essential terms. I want to begin by defining HIV criminalization. So HIV criminalization refers to laws, policies, and practices that impose heightened criminal penalties on people living with HIV for conduct that is not criminalized or criminalized less severely for people not living with HIV. Now, when we talk about HIV criminalization, these increased penalties can manifest as distinct criminal offenses. You've probably often heard of these as exposure or transmission offenses. They can also manifest as enhancements that increase the length of incarcerations or fines, forced testing or treatment, or other severe penalties such as registration on the sex offense registry and compliance with extensive restrictions. HIV criminalization can also occur through the general criminal law. So when I talk about the general criminal code or general criminal laws, we're thinking about something such as aggravated assault. They don't specifically mention HIV or any communicable disease, but case law has interpreted these general criminal laws as being applicable to the behaviors of people living with HIV. HIV criminalization is a product of inaccurate, stigmatized views based in queerphobia, white supremacy, and misogyny. And these laws emerged from and perpetuate these prejudiced, ignorant ideals. And we'll know from enforcement data that these laws especially affect people with intersecting marginalized identities, such as transgender and cisgender women, Black women engaging in sex work, and LGBTQ plus people, and people who inject drugs. Later in the webinar, Nathan will walk us through some of that data that really highlights the disparate impact of these laws. Next slide, please. As you heard me mention, I talked about HIV specific, so I now want to tell you what I mean when I say that. A law is HIV specific when it solely names HIV, or it uses an expansive definition of communicable disease that includes HIV, because it imposes criminal penalties or heightened criminal penalties on the behavior of an individual by explicitly singling them out based on their positive status. I want to note that the terms that are used to single out people living with HIV are diverse, and it's going to vary state by state. So you would have to look in your specific criminal code, but it can use anything from communicable disease, contagious disease, infectious disease, sexually transmitted infection or disease, or even venereal disease. Regardless of the exact language that's used in the law, the effect is the exact same. Someone's health status is named, and it's used as a means to criminalize them. Next slide, please. I also want to dive into what is an enhancement versus an offense. So, among laws that are HIV specific, there are generally these two different types of laws, either an offense or an enhancement. An offense is a law that imposes criminal punishment for engagement in certain behaviors in the context of HIV criminalization. Offenses impose criminal punishment on people living with HIV for behavior that is not criminally punished for people not living with HIV. So typically we're going to be thinking about having sex or donating blood. An enhancement, on the other hand, imposes heightened criminal punishment on top of an existing punishment. So for people living with HIV, these are increased penalties for engaging in criminalized behavior. So for example, sex work or sharing drug use equipment. Typically, sex work is a misdemeanor crime. However, if you know your status and you're living with HIV, it is automatically increased to a felony. That is what we call an enhancement. Next slide, please. So offenses or enhancements can then be broken down into several categories. So exposure, transmission, and non-disclosure offenses, you often are going to hear them used interchangeably, but these are separate and distinct offenses, and you must look closely at the statutory language to interpret which specific activity is being criminalized. So in an exposure law, it imposes criminal penalties on people living with HIV for engaging in specific behavior that purportedly creates the possibility of HIV transmission, having sex or sharing syringes, or more broadly, exposing another to HIV through any means or contact. It does not mean that there's an actual risk of transmission, but instead the law is focused on that perceived risk of transmission. Whereas a transmission law imposes increased criminal penalties for the transmission of HIV from one person to another, meaning the law requires seroconversion. And non-disclosure, while many states impose criminal penalties for exposure or transmission, some states additionally impose criminal penalties on people living with HIV for non-disclosure of HIV status to their sexual, drug use, or other partners. So that is, these states criminalize distinct behavior. So for example, in Indiana, there's a duty to inform law. People who do not fulfill this duty to inform their partners are punished through Indiana's failure to comply law. Next slide, please. I next want to dive into some of the most common features that we see with HIV criminal laws. Transmission is not required, so any kind of activity viewed as sex and allegations of non-disclosure are enough for prosecution under a statute that describes exposure or similar language. Risk of transmission is largely irrelevant, and what that means is that risk reduction measures are not a defense to prosecution. So condom use or low viral load due to treatment do not matter. Negligible or zero risk activities such as oral sex and spitting can and are criminalized. Intent to harm is rarely considered or required. This means that the person does not have to have the specific intent to either expose someone or transmit HIV to someone else. It's just enough to be living with HIV and not disclose. That is different from a lot of criminal laws. Typically in criminal law, you have to have some sort of intent element. Proof of disclosure is often the only defense, and we know from personal stories, news coverage, and case law that disclosure is often exceedingly difficult to prove, and that's because it's one person's word against the other. And these laws often impose severe and disproportionate punishment, typically and very common for us to see felony level punishment, even when no harm or transmission has occurred. And sex offense registration occurs in 5 states. Next slide, please. This slide is going to show you not only those 5 states, but a look and snapshot of the national landscape as it relates to HIV criminalization, exposure, and transmission offenses. So there are 32 states with an HIV-specific exposure or transmission offense, meaning these states have laws that directly or indirectly single out the behavior of people living with HIV for criminal punishment. It's critical to note that this map only accounts for HIV criminalization through these HIV specific offenses. It doesn't account for general criminal laws where people are facing criminalization. So we know that prosecutors across the United States have leveraged general criminal laws, including aggravated assault, reckless endangerment, and even attempted murder, to impose criminal penalties on people living with HIV. It's exceedingly difficult to comprehensively track prosecutions of people living with HIV, especially through the use of general criminal laws. We've relied mostly on legal research, namely case law, coalition contacts, news reports, and social media, to conclude that the general criminal laws have been applied to perpetuate HIV criminalization. Next slide, please. I just wanted to quickly flash our QR code so that you can check out not only our HIV criminalization map, but also our enhancement maps that go along with it. I'd encourage you to explore these resources, and please reach out if you have any questions or requests for legal and or policy support. That QR code will take you directly not only to the maps, but also that user guide. Next slide, please. I wanted to wrap up my presentation by just talking about how HIV criminalization harms our communities. So, to be clear, there's no evidence that these laws improve public health, no evidence that they deter behaviors that are more likely to result in transmission, promote disclosure, or reduce the number of diagnoses. But there is broad and growing evidence that these laws harm our communities. These laws exacerbate stigma against HIV and people living with HIV. And we know HIV stigma remains a destructive factor for people living with HIV and further marginalizes people from HIV services. Moreover, these laws worsen the barriers to HIV prevention, testing, and treatment services. For example, many of these laws apply only to people who are aware of their status. So that's a clear disincentive to get tested and become aware of one's status. And we know that CDC research has found an association between broader, more harmful HIV criminalization laws and decreased engagement in HIV testing. So there is an association between reformed HIV criminal laws and improved testing engagement. These laws perpetuate one-sided messaging about sexual health and prevention responsibility. It's not solely the responsibility of the person living with HIV to engage in conversations about HIV and other STIs, but rather open communication between two consenting adults. And these laws also disproportionately harm marginalized populations, including people of color, Black people, LGBTQ communities, sex workers, people who use drugs, and undocumented immigrants. And in our work, we always like to emphasize these disparate impacts and center the communities made most vulnerable to criminalization. Next slide. This is just our source book. If you want to figure out what is going on in your state and what the law states, please scan this QR code at this time. And I'm going to pass it back to Nathan. Thank you.
Yeah, thank you, Jada. And I'll leave the screen here for just one moment. Your source book has been an incredibly valuable tool, not just in our own work, but in the work of state coalitions and national partners. So I encourage everyone to please look at the source book. You can go state by state even. I now want to turn to what we know about HIV criminalization in the United States. I think Jada did a good job laying a foundation, an HIV criminalization 101, and also why we should be talking about this today on World AIDS Day. Here's where I'd like to go in my remarks. I'd like to actually give us a little more history on on HIV criminalization here in the United States. Where did these laws come from? I mean, we have a little bit of concrete evidence about that. Then I want to talk about the history of HIV criminalization here at the Williams Institute. And then finally, what we know about HIV criminalization, again, in the United States because of work done here at the Williams Institute. And if you're looking for a broader and international perspective as well, I encourage you to look back through our webinar archive. In 2021, we did a webinar on World AIDS Day looking at both the domestic and international context of HIV criminalization. Here today, we'll be talking about the United States. And let me turn to that history of HIV criminalization now. I want to emphasize what Jada mentioned, which is that most of these HIV criminal laws were enacted really at the height of the AIDS crisis. It was a time of tremendous fear and stigma, and it breaks my heart to say that there is still tremendous fear, stigma, shame around HIV today in the United States. But in the 1980s, there was much less known about how HIV is and is not transmitted. That's actually a bit of a misnomer. We actually had pretty good science by the mid to late 1980s about how HIV is and is not transmitted. That had not yet, I think, percolated to the general public. And again, I think the general public doesn't have maybe the latest science in medicine on HIV transmission at the ready. And the big difference between the 1980s and mid 1990s and today is that now we have incredibly effective medication treatments to both prevent HIV transmission, whether you're a person living with HIV or a person not living with HIV, and to treat HIV. HIV today can be a manageable chronic condition, just like diabetes or hypertension. The difference, of course, is that diabetes and hypertension, again, don't have that tremendous stigma and fear associated with it. And when we look at the legislative record here in the United States in these state houses, we know that many of these laws were motivated by fear, that fear was often racialized, and that there was a lot of homophobia motivating the laws as well. Early in the HIV epidemic, there was an association with the so-called four H's. That was homos, men who have sex with men, Haitians, which here was standing in for both Black people and people who were foreign to the United States, heroin users, that is, people who use injection drugs, and hemophiliacs. And the original federal Ryan White CARE Act actually tied federal funding of HIV to the enactment of criminal penalties for knowing HIV exposure. I won't belabor the point, but the media has done a poor job, I would say, in covering the HIV epidemic here in the United States and also HIV criminalization. They tend to focus on sensationalized stories. And when we look at the evidence, what the headlines are covering and what we actually know about both the HIV epidemic and HIV criminalization look dramatically different. Here's a slide that just shows you when states started enacting their HIV criminal laws, and the citation is on the bottom. That red line is basically when the Ryan White CARE Act was passed. And I should say that clause requiring states pass HIV criminal laws was removed in later iterations. But you can see some states were very early on in criminalizing people living with HIV. But really, over the next 2 decades after the Ryan White Act was passed, states were still continuing to criminalize people living with HIV. The title of today's talk is in part 40 Years of HIV Criminalization. There was actually a bill in New Jersey in 1985, that is 40 years ago this year, that was attempting to criminalize people living with HIV. And just the next year, in 1986, was the first successful bill passage. Let me give you a concrete example of what these laws might look like. This is in Indiana, and this is a figure taken from our transmission risk report in Indiana. Indiana already had one of these fluid exposure laws, battery by bodily fluid or a waste, passed in 1995. It essentially made it a felony for a person living with HIV or hepatitis to expose another person to bodily fluids or bodily waste. That could include saliva, tears, blood, urine, feces. It's important to emphasize that none of these fluids and the ways in which the exposure were contemplated in the legislation are actual transmission risks. So the battery by bodily fluid law, this fluid exposure law, passed in the mid 1990s in Indiana, only criminalized behavior that we know cannot transmit HIV. Well, there was actually in 2002 another law, malicious mischief, that essentially criminalized the same behavior. Again, it's the fluid exposure law, but here it's the intent is somebody sort of happens upon or comes upon the fluid instead of it being actively exposed to it. Well, how did the second law that seems to criminalize the same, again, non-transmission routes come about? One of our colleagues uncovered this newspaper article. The text is small, but let me just give you a summary. That the story is that there was a 14-year-old person in high school who filled up a water bottle with warm water, poured it on another student's head, claimed it was urine. That a child who had the water dumped on them told their parent. They were taken to a doctor. The doctor suggested HIV and hepatitis testing, not just then, but every 3 months for the next year. There was no HIV or hepatitis risk, regardless of the fluid here. And again, it was, according to the story, water. There was a substantial medical bill. A lawmaker heard about this and decided to introduce a bill that would create felony penalties, again, for people living with HIV, also viral hepatitis and tuberculosis. So again, it's fear, stigma, it's ignorance about HIV transmission routes that creates these special penalties for people living with HIV and other stigmatized health conditions. Let me talk now a little bit about the history of HIV criminalization here at the Williams Institute, and I'll do so by mentioning our mission statement. Really, the Williams Institute was founded on the belief that facts matter. We want facts and data, not stereotype, fear, and stigma to inform laws and policies that especially affect the LGBTQ community. The idea is that data and knowledge about individuals and our families and our communities should be informing lawmakers, judges, and other key stakeholders. And you can see the relationship there with HIV and HIV criminalization too. Here's the cover page of several of our reports, starting with the very first one published 10 years ago this month. This was HIV criminalization in California, and I'm happy to say that two of those co-authors, Ayako and Bianca, are still with us at UCLA over in our policy school, doing good work on similar themes. We have a data interactive that at the very top shows this map that I've taken a screenshot of, and we can put the link in the chat. We now have across 10 years, 24 reports covering 15 states, and you can see from California to Maryland to blue states, from Indiana to Louisiana to red states, that HIV criminalization and our analyses of these HIV criminal laws really spans the United States. This is not a red state or a blue state issue. This is not a left coast or a right coast issue. Let me talk now about what we've learned from these 24 reports, 15 states, and I'll say more coming hopefully in the new year as well. There's a lot of text on this slide, but I'm going to walk through each of the points in turn. But let me give you a high-level overview. As Jada says, most of the arrests, prosecutions, and convictions that we've been able to document in our reports are pursuant to laws that don't require actual transmission, the intent to transmit, substantial transmission risk, even conduct sometimes that can transmit HIV, as you saw in the Indiana example. They don't often include mitigation strategies as defenses. And again, we have really good medical tools today to help people living with HIV and people not living with HIV. And many of these laws, as you saw, were passed before these medical advances became widely available. We know that at least thousands of people have been criminalized because of their HIV status. That's just those that we've been able to document. We know that enforcement continues to this day. Wherever we request data from a state on HIV criminal enforcement, we basically get enforcement data all the way up to the year in which we've requested the data. This is not a problem that went away in the 1980s or 1990s. We also know, as Jada said, that certain populations are disproportionately affected by HIV criminalization. That's especially Black Americans, women, and sex workers. Unfortunately, we can't say much about sexual orientation or gender identity in the administrative data, but we do know from other research, some of it at the Williams Institute, that sexual and gender minorities are at particular risk of substantial harm from any contact with the criminal legal system, from police interactions all the way through incarceration, and that's especially true of gender minorities. We also know that enforcement is geographically concentrated. That tells us it doesn't map onto where people living with HIV or even where the state population is. That tells us that this is about policing or prosecutorial practice and not so much about public health. And finally, there are lifelong consequences. Let me go through two through the end of those bullet points now. This is just, I took five of our reports with, large populations just to count the number of people. This isn't even the number of cases or number of charges. And the data that we receive in these reports is just a small shadow of what's going on. Sometimes it's not geographically or chronologically complete. It doesn't include prosecutions under the general criminal law. As Jada mentioned, we've seen things like bioterrorism, assault with a deadly weapon, attempted murder. These numbers don't include that. And if you just add up from these 5 states alone, well over 2,600 people, individuals who came into contact with the criminal legal system because of their HIV status. To show you time trends, I picked Ohio here, but I could pick another state. And in fact, you'll see another in a minute. Cuyahoga County is where the state's largest city is. And you can see we requested data through 2022, and we saw enforcement through 2022. And enforcement wasn't going down over time. In fact, in some states, it can increase over time. This is from our Missouri report, and I apologize for the small font. From 1990 to 2019, what we see is a new offense is added. It's actually one of those fluid exposure offenses. And you see when that happens, enforcement explodes. So this, again, is not something that's going away over time. Again, people are still being criminalized 40 years into this movement to criminalize people living with HIV. As I said, some populations are are particularly vulnerable to criminalization. I want to focus on Black people living not just in Georgia that you see on the right-hand side, but in California and every state in between. HIV criminalization lives at the intersection of both the HIV epidemic, which disproportionately affects Black Americans, and the epidemic of over-policing and incarceration, which also disproportionately affects Black Americans. So you can see, for example, in California, Black people were 6% of the state's population when we did our report. 17% of people living with HIV, there's a disproportionality there actually, but they were 40% of HIV-related convictions. This pattern doesn't always hold, but it's consistent enough that our expectation is usually that there are going to be substantial disproportionalities by race wherever we look. And I'll show that actually to you here in Maryland. We're fortunate to have someone actually two people who were instrumental in HIV criminalization reform in Maryland. And you can see that disproportionality here on the right-hand side as well. Again, Black Marylanders were 30% of the state's population, but 82% of HIV-related criminal cases. And on the left-hand side, you see where enforcement was happening, a lot of it in the Baltimore area, but also in the counties surrounding Washington, D.C. This tells us that it's something about what police and prosecutors are doing in these counties, not so much about the distribution of people living with HIV in the state. Let me go down to Tennessee now, and I'll make the 2 points again. On the right-hand side, you see, so we looked at Shelby County. Shelby County is where Memphis is, and something like 2/3 to 75% of these aggravated prostitution, that's sex work while positive, convictions that then had, these were felony convictions that then had at the time lifetime sex offender registration. 75% of those were Black women in Memphis. Another 18% were Black men, and we have reason to believe that there are gender minorities in there who aren't being represented. So overwhelmingly, Black people in Shelby County were the ones who were being caught up in these aggravated prostitution arrests, convictions, and sex offender registration. When we looked at the actual police affidavits, what we found was overwhelmingly this was a case of policing practice. These were vice squads. The allegation was that an undercover police officer approached someone who they thought was engaged in sex work. They had a conversation about that sex work, and then the person was arrested. A conversation about sex work is not an HIV transmission route. When we looked at the sex offender registry, which I'm happy to say for both of the Tennessee's two HIV-related criminal laws now, there is no longer mandatory sex offender registration. That is because of the hard work of state coalition members pushing the legislature time and time again to change things. But at the time we did our report, unfortunately, there was mandatory lifetime sex offender registration. If you looked at Black women on the sex offender registry, They were less than 1% of the state of the of people on the sex offender registry, but they were about a third of people on the registry for an HIV related conviction. In other words, Black women were very unlikely to be on the sex offender registry, but if they were on the sex offender registry, they were there because of an HIV related conviction. I see my colleague Ronnie has come off of mute now. Why don't I hand it over to Ronnie? I'm sorry, to Michael Elizabeth, and then we'll go to Ronnie. Ronnie, I'm eager to hear about what you did in Maryland. Speaking of reform in Tennessee, I'm eager to see how reformers do it. Let's first hear from Michael Elizabeth, actually, about why this matters.
And give me 1 second while I find my
I
window.
would be happy to.
Um,
And Michael Elizabeth, I have also your slides here if you'd like me to share them.
Too late. Thank you. But I'm not able to see the chat now if folks have questions or comments. But thank you, Williams Institute, for this space, and thank you, Jada with CHLP, and I look forward to hearing from my good sister and person who I take notes from all the time, Ronnie Taylor, in a second. So I'm gonna make this quick. As someone who, I'm speaking about myself, but as someone who is Black, trans, and non-binary, and a person living with HIV, um, sharing this moment with you all on World AIDS Day is definitely an honor. And I would like to remind us that, like, for many of us, World AIDS Day is every day and not just today. And so as we learn about this really critical issue today, I hope that we are also learning how can we adapt advocacy practices around this going forward every day throughout the year. Um, Across the country, HIV criminalization continues 40 years into this epidemic, even as science, medicine, and lived experience tell us clearly that HIV is preventable, HIV is treatable, and people living with HIV can live long, healthy lives and cannot sexually transmit HIV when on effective treatment, when achieving virus suppression. All of this matters because the law still treats us like vectors of disease rather than full human beings. And so what we're hoping to break down today is like how is, and I always skip over explaining what Equality Federation is. You can visit our website, www.equalityfederation.org, to learn more about how we support state-based LGBTQ advocacy to really accelerate progress for our communities wherever we call home. But I wanted to touch on how HIV criminalization is a health justice issue first. And I'm happy to drop in the chat after this, but links to all of these resources. But as we just heard, criminalization directly undermines public health. It discourages testing and treatment, the very tools we need to end this epidemic. For example, in Arkansas, which I was, just provide more state examples than Nathan already beautifully illustrated for us. Um, a person living with HIV can face up to 30 years in prison, even when using prevention methods and with no transmission occurring. In Oklahoma, a felony conviction is possible for consensual sex, even when there's no negligible risk of transmission, including oral sex or spitting. So essentially, when knowing your status increases the risk of prosecution, people are less likely to get tested. This is not a public health strategy. This is, quite frankly, a public health sabotage. What we learned, oops, not ready for that yet. And by the way, all this data that you're going to see on Equality Fed resources that are state specific and throughout this presentation came from Williams Institute. So thank you, Williams Institute, again, for all the labor that you all do that could be better honored and resourced, maybe. So back to what I'm supposed to say. Yeah, and criminalization clashes with 40 years of HIV science and progress. As I said earlier, HIV is a chronic condition that's manageable when we have access to the treatment services we need. And so also what is not considered in criminalization policy is like how prevention methods have advanced as well. It doesn't consider PrEP and PEP reduce the risk of transmission by 99%. Nor does it really focus how policies prioritize access to these treatment services as opposed to criminalizing those of us who just happen to be living with HIV. As Nathan said, a lot of these laws were written in the late 1980s and early 1990s before we had effective treatment. before we understood transmission, and before LGBTQ communities and other, quite frankly, communities had legal or political protections. And then also criminalization leads us into our next, segment on like racial justice. Criminalization disproportionately punishes people who are already over-policed. This is where the health justice framework merges, quite frankly, with the racial justice framework that we tend to operate in. So why is criminalization a racial justice issue? You just heard a lot of that from Nathan, the disproportionate impact that criminalization oftentimes have. Like again, from the Williams Institute, and I'm not going to go into details about the Arkansas data because the slides include literally our Arkansas one-pager that we have that breaks it down in more specifics. But overall, Black people are 3 times more likely to be arrested for HIV-related charges, what we learned from the Arkansas data, which is quite frankly an example of what we're seeing across the country. Black men are 6 times more likely to be arrested despite being only 7% of the state population and 31% of people living with HIV in Arkansas. Nearly half of all arrests come from just 3 counties in Arkansas, which again is plus ones everything that Nathan just said about oftentimes this is not necessarily an approach that's universal across the entire states, but specific areas within the state or jurisdiction that don't necessarily have the same comprehensive understandings of where we are when it comes to our fight against HIV. And they're very concentrated in specific police departments like Little Rock PD and Fort Bend police departments. And then, of course, we just went over those similar statistics in Maryland. So essentially, criminalization reinforces a larger system of controlling Black and brown bodies. We even see how criminalization can expand to not just HIV criminalization, but to STI criminalization as a whole, really using that same flawed racialized blueprint to further criminalize even more people. So for example, in Louisiana this year, we had House Bill 76 that nearly used the HIV criminalization law to like expand essentially to all STIs or a good number of STIs. And turning almost literally every adult in Louisiana into a potential felon for simply knowing our health status. And we already know how the what they call criminal justice system disproportionately impacts Black and brown people and those of us who may happen to be undocumented. I want to go into a little bit more detail about like, because oftentimes what we just heard from Nathan and Jada earlier, that like lawmakers would use constituents' stories to support criminalization attempts through lead sessions. And oftentimes it comes from survivors, right? Survivors of sexual assault or intimate partnered violence. What oftentimes don't get disclosed is how criminalization, HIV criminalization that can expand to STI criminalization doesn't just punish HIV status or STI status. It deepens and exploits the vulnerabilities created by racism, sexism, transphobia, poverty, and violence. One of the clearest examples of this connection is between HIV and intimate partner violence and racial justice. So for example, intimate partner violence is both a cause and a consequence of just living with HIV. People living with HIV, especially Black women and transgender people, are at higher risk of violence because of their HIV, because of our HIV status. Making HIV disclosure dangerous because this all makes HIV disclosure very dangerous because disclosing your status in a violent or corrosive relationship can increase the risk of harm overall. Giving abusive partners another tool of control. You can, for example, threaten to report someone for an HIV-related crime, even when no harm occurred. And so essentially, this is not about safety. This is about punishment disguised as protection. And usually they disguise it as protecting those who we socially would say are more vulnerable, even though that consistency when it comes to policymaking is not shared when it comes to gender-based based pay equity, et cetera. And so the racial and gender disparities are not accidental. They are rooted in structural inequities that are not addressed by these laws. Black women experience higher rates of inter-partner violence and higher rates of HIV, not because of individual behavior, but because of a systematic racism, economic marginalization, and unequal access to care. So Essentially, these disparities mirror what Black women face and Black people, Black femme people face at intersections of intimate partner violence and HIV. Higher exposures to violence, lower access to stable housing and healthcare, and greater economic vulnerability, and increased likelihood of state surveillance and punishment. So criminalization is not race neutral, it's a racial justice issue as well. That was a lot. I wanted to also, Ronnie's going to give you this, but Maryland example, but this is how basically incorporating racial justice priorities and advocacy into your decrim efforts can be very effective. And so we were able to use the Williams Institute data that highlights these impacts, these racialized impacts, in our narrative and how we talked about decrim efforts in Maryland, but also in our strategy that Ronnie's going to talk about in more detail. We did the same thing to help kill the STI criminalization bill in Louisiana, thanks in partnership to CHOP. And you can read this op-ed written by CHOP's executive director, Mandisa Moore O'Neill, and a coalition member in Louisiana, Ms. Foster, who I have so much respect for, co-authored this op-ed to help kill the STI criminalization bill in Louisiana that highlighted the racial impact it would specifically have on Black and Brown women. We always encourage people, especially if you're getting involved in local advocacy, to encourage your local media to use the HIV media guidance we provided. It's a non-political, facts-based media guidance because oftentimes these issues, the reporters, especially local or statewide reporters, don't have the same updated understandings that they need to have in order not to recycle HIV stigma that can get in our way and encourage this type of bad legislation. Um, yeah, I don't have to talk about that anymore. We just did that. So yeah, I definitely appreciate the space that you all provided today. What we're seeing across the nation is actually how they're using HIV criminalization as a blueprint for other types of criminalization. The new administration is figuring out ways to criminalize harm reduction practices. Of course, they're criminalizing any type of access to gender-affirming care. And so, quite frankly, how we address HIV criminalization can also now be used as a blueprint for how can we address these other forms of criminalization that we're seeing impacting so many different parts of our communities. These slides will also include additional resources that have links to our virtual trainings we've had throughout the year that also includes Ronnie Taylor and Philip, the Executive Director of Free State Justice, in several trainings as well, talking about HIV criminalization. There's a powerful toolkit by AIDS United and the U.S. People Living with HIV Caucus on embodying meaningful involvement of people living with HIV, specifically on how can we follow and encourage the leadership of people living with HIV in our work. And then, of course, you can always email us if you need to be connected to a state partner in your state as you can want to do more work around modernization efforts. And I just want to quickly say thank you for the opportunity to talk about this. If you have any questions, you can always email us at publichealth@equalityfederation.org. I think that's it for me.
Thank you so much, and I'm glad that you left us going up on a high note, and I think Ronnie is going to take us home on that high note. Let me, Ronnie, share the beautiful slides that you've been able to share with us. Hold on one second. There we are, and we'll share and start from the first slide. There we go.
Awesome. Thank you so much, Nathan. Ronnie Taylor, she, her pronouns. I serve as the Community Impact Director here at Free State. And I like to give credit where credit is due. I actually did not fully make these slides. These have been in collaboration with our national partners over at Equality Federation, an amazing comms team that we have. Thank you all for allowing me into the space. One of the things that I've been sitting with, I just left the speaking event and I'm so humbled. We all have a status. I just happen to be HIV possible. And so I'm super thankful to be able to speak about this subject matter. And so, in the spirit of us all needing some good news right now, HIV is no longer a crime here in Maryland. We won and we're doing the work and we're going to continue to do the work as we move forward. And so next slide, please. You've heard so much about what is HIV decrim, but Maryland's former law, Health Code 18-601.1, criminalized transmission and disproportionately impacted Black people and queer people. Next slide. And so what we wanted to do is we wanted to build an experience. I had the honor and privilege of being on this legislation from both sides. One being a former chief of staff in the Maryland General Assembly, and then coming on board to this amazing organization, Free State Justice, in which we were able to lead the charge. And so in the 2024 session, we ran a strong campaign, y'all. We had testimony, coalition mobilization, action alerts, and paid calls. Unfortunately, the bill stalled because of a committee chair and one advocacy group. Um, However, I want to highlight the level of persistence. Good to note, and I want to note that in the 2025 session, that one advocacy group came out in favor of the piece of legislation and switched their positionality, and the committee chair who stalled on the bill actually became our cross file for the Senate. And so as soon as the 2024 session ended, we went back to work. We analyzed every barrier, rebuilt the plan, and started earlier than ever. And so that early start allowed the organization to fundraise, organize, and strengthen relationships months before the session even began. Next slide. And so this win was only because of the depth of the coalition. Here is an example of some of the op-eds that were used. And so if you go to the next slide for me, wanted to highlight these amazing coalition partners. Can't name everyone, but the Maryland Coalition, HIV Coalition members represented the legal experts, public health departments, national HIV leaders, advocates, most importantly, people living with HIV and organizations rooted in Black and LGBT communities. And so the mix of local and national voices allowed us to generate pressure. We were able to shift the narrative and keep the issue visible. Next slide. Free State Justice built an advocacy team with relationships deep enough to navigate Annapolis. We engaged in the Black Caucus early, highlighting racial disparities in HIV criminalization penalties and framing the bill within a broader public health approach. We paired criminalization with a set of policies that expand access to prevention with care. And so that framing helped legislators understand this wasn't a niche policy. It was a public health priority with racial equity at the center, very similar to what Michael Elizabeth just mentioned. Next slide. And one of the amazing parts about community energy drove this campaign, y'all. We had paid calls, coordinated emails, and direct outreach generated. There were over 200 calls to legislators, 135 emails to legislators, 80 emails sent directly to the governor and his team, and everyday advocates learned how to push the message in their own communities. We met people where they were, and we gave them the tools to act on it. Next slide. And so one of my favorite parts is the strategy that went into it. And so Pathway to Progress brought more than 100 advocates out together and raised more than $50,000. And this event centered lived experience individuals, grounded our strategy and community, and elevated clear testimony on how criminalization harms public health and dignity. It gave lawmakers and stakeholders a front row view of why modernization was important. Next slide. And so going into the strategic communication, we have a list of legislative champions here. Our communication, our communication strategy blended earned media, paid ads, and a narrative rooted in the voices of people living with HIV. We lifted Maryland leaders, we pushed national voices into the conversation, and we addressed lawmakers' concerns from the 2024 session. We did that across radio, digital platforms, LinkedIn, and Google search, and we were intentional about targeting Black Marylanders, legislators and their staff, LGBTQ plus communities, and people living with HIV. And with the traditional radio delivered more than 2.1 million impressions, reaching Black audiences and decision makers statewide. And so those legislative champions, these leaders carried the legislation with resolve. Their partnership with the coalition, because that was super important, gave the bill credibility, political weight, and momentum that held through the finish line. Next slide. And so I talked about the reach and this goes into how we were intentional about how we targeted. Particularly here in Maryland, we dealt with a region in which we referred to as the Bible Belt, and those were the Black legislators that were apprehensive in the beginning towards the bill. And so these numbers went into that piece of collection. Next slide. All of which I've highlighted. Next slide. And so this was one of our amazing op-eds done by former CEO of AIDS United, Jesse Milan and Ronald Johnson. This was published in Maryland Matters, and this was a really insightful piece for legislators to be able to hone in on and read. It raised awareness of the advancements and treatments of prevention, because we wanted to get out of the mindset of the 1980s disease that folks once viewed it as. Next slide. And so we were intentional with our audiences to target Black radio. And so we ran paid media on, again, almost every platform there was that also consisted of a podcast. In addition to, we highlighted the 92 Qs, the 93.9s, the 95.5s, and the 96.3s throughout the Beltway. There's a slide in which I'm going to allow you all to hear the commercial, but one of the highlights for me was my grandmother calling me as she dropped my 5-year-old niece off to school. And the conversation was, that's TT Ronnie's job. And so the commercial not only did what we wanted it to do, but it was intentional about getting to the kitchen table conversation, so much so that my grandmother honed in and called every time she heard the commercial. Next slide. And so this wouldn't have been able to do it. We recognized this was a very different approach, and it just so happened to work for Maryland. And that approach was done thanks to our amazing donors at NMAC and Equality Federation. Next slide. Again, all of the stations, these were the impressions. And so our radio ad ran and ranged from 3 to 6 weeks on those stations with intentionality. Next slide. And so this is the radio ad.
Let's see if we can hear it. Oh. I think the audio might be disabled for this, Ronnie. Why don't we figure out a way of sharing with audience members the
Certainly. And if
radio
you ever have
ad?
time, please feel free to visit the Free State Justice website under HIV advocacy. But the amazing piece about working with our comms ad, the radio ad was read by a Black woman with Black music, soft music in the background done by a Baltimore-based artist. And so it was short, sweet, and to the point. And Michael Elizabeth has also dropped it in the chat. Next slide. And so what's next for Free State? We are sharing these lessons with partners nationwide. I've been able to talk with the Arkansas group. I've been able to be a part of convenings and coalitions. And so we're super excited as we're not looking to gatekeep this work. And so we are pushing back against, of course, the national funding cuts to HIV programs. And our next priority in Maryland is expanding access to PrEP and strengthening prevention efforts so every community has what it needs to stay safe and healthy. And I think that's it, Nathan. Thank you.
Thank you, Ronnie. I wonder if I can take a little bit of moderator's privilege and go back to this picture. And can you just tell us all what we're seeing in this picture right here?
Certainly, certainly. That is a photo of myself and our great governor, the 63rd governor in Maryland and the only current Black sitting governor, Wes Moore. Fun fact, he actually ran on this piece of legislation. You can still find HIV Decrim on his campaign website. And so that was our we did it handshake.
And can you tell us briefly what was the name of the bill that wound up getting signed into law here?
Yeah, oh my God, I forgot. And I didn't, I honestly forget. I try not to get emotional.
Yeah.
As today is World AIDS Awareness Day, we were really intentional with our strategy in naming this bill after an icon and someone who served as the Duchess. It was known as the Duchess, of Baltimore City, the unspoken mayor of Mount Vernon, which is our neighborhood here, a gentleman by the name of Carlton R. Smith Jr. Carlton was a great friend and mentor of mine, someone that I look to this work truly, spent time with us in Annapolis, um, lobbying, lobbying legislators. And he unfortunately passed at the end of the 2024 session. And so, in a way to honor him, we renamed the bill the Carlton R. Smith Jr. HIV Modernization Act. And although we named it the Modernization Act, we never buckled on our intent for full repeal.
Thank you so much for sharing that story and that history, Ronnie, especially today on World AIDS Day. We have just a few minutes left, and I want to make sure if there are any questions in the chat that have come up, we give a space for everybody who spent this hour with us here today. And I'll see if in the Q&A we can answer anything. There was a question earlier actually about reform history. Jada, I wonder if you're able to provide to everybody the timeline of HIV criminalization reforms that the Center for HIV Law and Policy has put together. Maryland is one of the most recent in a long line now of states, both red states and blue states, that have achieved HIV criminalization reform, including, for example, in Georgia. Um, I want to now, in the just very, very briefly, a lightning round for each of you, and maybe we can go Jada, Michael, Elizabeth, and Ronnie. What do you want us, if we came back here in 10 years' time to talk about 50 years of HIV criminalization, what do you want that conversation to look like? And I hope everybody who's here today will come back and join us in 10 years. But what will that conversation look like when you imagine it? Jada and then Michael, Elizabeth, and then Ronnie.
I hope that I don't have this job in this form in that many years. I always say, like, please put me out of a job. I hope that I don't have to sit here and analyze ways that people living with HIV and other stigmatized health conditions can face criminalization. For me, that would be like, we did it. I want to have that Ronnie Taylor moment of like, we did it with the governor in every state that has these laws. So I really think for me, envisioning a world where folks just are not criminalized based on their health status anymore. And the criminal legal system isn't used as another tool to not only oppress people living with HIV, but people that have intersecting marginalized identities, and that we really remove the tool right from like a white supremacist, misogynistic toolbox that they can't use against us. That is my hope.
Yeah, that's wild. This question was not pre-planned. No, I would say in 10 years is not actually a lot of time. It takes us roughly 2 to 4 years in a friendly state to pass modernization bill. And so to achieve this effort, to be out of a job in 10 years, probably would require federal intervention. So we would need a congressional, decrim bill that actually decriminalizes HIV, not just studies it. That was not a criticism or a read, just a statement. And then I would also just say I look forward to us figuring out how can we bake in retroactive expungement into our decrim effort to really repair the harm done to those of us living with HIV who've already been criminalized. And then have policies, best practices in place where we don't have to leave any community behind in our decrim efforts, whether you're a sex worker, a personal trans experience, et cetera, to be able to protect all of our people living with HIV from criminalization.
Ronnie, I'll give you the last word.
Michael Elizabeth definitely stole my answer, but that's how sync she and I are in with each other. No, it's one of the things that in 10 years, as we were talking about this, I think those in particularly, just call to action. That's just who I am, right?
Mm,
In 10 years, I want white people to stop walking out of the room when we talk about HIV decrim. I want there to be a full investment when we talk about HIV decrim,
mm,
because we're often talking about ending the HIV epidemic, but we hardly ever touch on this. And so an understanding that the investment is decrim. And so in those conversations, going back to the expungements and the restorative justice practices, understanding that the first acronym to all of this is human. And so putting humans first and recognizing the harm that has been done within states and going back to the human approach. And so that ideally, that's where I'd love to be in the next 20 years.
Well, thank you, everyone. Thank you for those answers. I want to call out as well on February 28th, HIV is Not a Crime Awareness Day. Our national partner, Zero Project, has been leading the way on that. So please stay tuned for more on this topic on February 28th. Thank you to all of our panelists today and to our attendees.